What is a PET scan for colon health? Have you ever wondered how doctors can see what's happening inside your body, especially when it comes to colon health? One important tool they use is a PET scan, which stands for positron emission tomography scan. This specialized imaging test is primarily used to detect, stage, and monitor colon cancer. It works by visualizing the metabolic activity of tissues, helping doctors identify cancerous cells that often have higher metabolic rates than normal cells. In the context of colon cancer, a PET scan plays several crucial roles. First, it helps in staging the cancer. This means it determines how far the cancer has spread, particularly to distant organs like the liver or lungs. Knowing the extent of the cancer is vital for planning the right treatment. Another important use of a PET scan is detecting metastases. This means it can identify secondary cancer growths that have spread from the primary colon tumor to other parts of the body. This information is essential for understanding the overall impact of the disease. Additionally, PET scans are valuable for monitoring treatment response. They can evaluate how well chemotherapy or other treatments are working by observing changes in metabolic activity. This helps doctors make informed decisions about continuing or adjusting treatment plans. PET scans are also useful for detecting recurrence. After treatment, if other tests or tumor markers suggest the presence of cancer, a PET scan can provide clarity, especially when imaging results are inconclusive. Often, a PET scan is combined with a CT scan, creating what is known as a PET-CT scan. This combination provides detailed anatomical images alongside metabolic information, improving accuracy in locating tumors and differentiating cancerous tissue from non-cancerous abnormalities. The procedure involves injecting a small amount of a radioactive sugar-like substance, known as a radiotracer, into the bloodstream. Cancer cells consume more glucose than normal cells, so they absorb more of this tracer. The PET scanner detects signals emitted by the tracer, creating images that show areas of high metabolic activity. Preparation for a PET scan typically includes fasting for several hours and avoiding substances like caffeine or tobacco before the test. While the radiation exposure from a PET scan is low and generally considered safe, patients should inform their medical team if they are pregnant, breastfeeding, or have diabetes. While PET scans are particularly valuable in advanced stages of colon cancer, especially stages 3 and 4, they are less commonly used for the initial diagnosis of early-stage colon cancer unless other imaging results are unclear. It's important to note that there are limitations. For example, false positives can occur due to inflammation or infection, and false negatives may happen in certain cancer types. Therefore, PET scan results are interpreted alongside other clinical and imaging findings. Overall, a PET scan is a powerful tool in managing colon cancer. It aids in accurate diagnosis, treatment planning, and follow-up care, significantly contributing to colon health. Remember, if you have questions or concerns about colon health or the use of PET scans, it's always best to consult with a healthcare professional for personalized advice.